Hello everyone and welcome to Inside Healthcare. Mental illness and chemical dependency is more common than you might think. It affects people from all walks of life. In a moment we'll take you inside look at this growing health issue and tell you about a treatment program that really works. But first, a new weight loss program that could be just what your doctor orders. It is what Amy's doctor prescribed for her, and she's glad her doctor did. Here's Amy's story.
I was driving home from work around 7 p.m. and a young man was texting and came on the highway, crossed 3 lanes, and hit my Expedition twice. I ended up flipping end over end and landing on the other side of the highway and got hit by a semi. And so with that accident, it was 2 years of physical therapy. I had back injuries, head injuries, lots of chronic pain, chronic headaches. The physical therapy helped. But, I had depression as well. I gained 80 pounds, and the chronic headaches and the loss of sleep is really what did me in. I mean, that was tough. The education with the nutrition and what she gave me to eat has really helped. Just making better choices, eating whole foods, and understanding every food has to be entered. It's one thing to log food like Weight Watchers does, but with this program and with a lot of the websites that are available now, you can really track the detail of the carbs, the proteins, and the sugars, and be aware of what is good to eat. It's not so much as the calories and the fat. It's all of those combined together. So I'm under 100 carbs a day, high protein, and then low sugar. And that's what's helped me. I've lost 60 pounds since January.
We really need to understand the whys of obesity better. And they can include certainly poor nutrition. They can include behaviors that we've developed over time that go against being able to be healthy. There can be psychological factors as well, fears of failure, fears of attaining an optimal weight. And those also, can be barriers to good weight loss.
That's hard. It's hard to be strict with it and do it every day, but I've stuck to it and I feel good. I really do feel better, 100%. And I'm sleeping better. So that was the gain, is my headaches are gone and I'm sleeping through the night. I don't wake up at 3 in the morning anymore.
And good, recover.
Amy has expressed interest in coming on Inside Healthcare to tell us why this weight program worked for her when others have not. We look forward to having Amy with us on a future broadcast. Now we turn our attention to mental illness and chemical dependency. We're very pleased to have with us George Wawro, mental illness and chemical dependency counselor with the HealthEast Mental Health and Addiction Clinic at St. Joseph's Hospital. Thank you for being with us.
No, it's good to be here, Jody. Thanks for inviting me on.
We really appreciate it. I know that you're very busy, so thank you for your time.
No problem.
So
Yeah.
I understand in our conversations that your clients range in ages from 18 to 75. What would your typical client or two, what would they look like? What are the mental illnesses or the chemical dependency that they suffer from?
Sure. Well, we work with adult men and women, all of whom have what we call co-occurring disorder, some mental health condition along with some addiction issues. And I can't say that we have a typical client. We have a pretty diverse group of individuals who are involved in our program, but many of them, for example, might struggle with depression and have been using alcohol perhaps to medicate that depression, unsuccessfully in the long run, but perhaps they developed some addiction to alcohol due to their depression, or perhaps they had alcohol problems prior to realizing they had depression. So many of our clients have either mood disorders like a depression or a bipolar disorder, thought disorders including schizophrenia or schizoaffective disorders, or anxiety disorders, which could be just a generalized anxiety disorder or PTSD or some other type of difficulty with anxiety. And they're struggling with substance use issues.
So why is it that some individuals who may develop mental illness such as depression and other disorders why do they also develop a chemical dependency? Why is there that connection?
Well, there is a connection there. And as a matter of fact, research has shown that perhaps a majority of individuals with substance use disorders also have a co-occurring mental health disorder. There are a number of reasons for that connection. As I had said before, sometimes people who struggle with anxiety or depression or mood swings really go to drugs like alcohol or other illicit drugs in order to medicate the symptoms of those disorders. So we do know that alcohol in the short term can sometimes really relieve anxiety. You know, many people talk about taking a drink and feeling more courageous or at ease or better looking or whatever the situation might be. And alcohol has also been shown in some to sort of lift people temporarily out of depression and allow them to feel more comfortable. However, we also know that alcohol is a sedative that in the long run has really negative effects on things like depression and on anxiety. So we call that self-medication, when people turn to alcohol or other drugs to kind of cope with the symptoms of the mental illness.
Alcohol seems very prominent, but also I've heard a lot about painkillers, that those are also becoming very addictive, and we're seeing a growing problem with those.
Definitely. Painkiller addiction has become a real problem in the past 10 years or so, and many of our clients are struggling with addictions to painkillers or narcotics, opioids. You know, painkillers are medications that are often prescribed appropriately by physicians to help people deal with post-surgical pain or even chronic pain issues. But there is something about them. They tend to cause a little bit of euphoria. They tend to numb feelings. And so many people find that they become addicted to them and sort of come to rely on them to deal with uncomfortable emotions and moods, as well as with, you know, physical pain symptoms. So we're seeing a lot of that. The philosophy that doctors embrace in treating pain changed about 25 years ago, and there was this theory that you try to stay ahead of the pain when people are struggling with pain issues, and really
Sort of like in Amy's case. She was talking about taking medications and stuff.
Yes, yes, and in some cases that's helpful, but in many cases people end up getting caught up really in a dependency on them. So we do see many people coming into our program and the hospital with narcotic addictions, and we do have several programs to help them with that. In our MICD program, we really do help people stay off the pain medications once they've been detoxed off them. And as a matter of fact, at HealthEast St. Joe's, we have a Suboxone clinic too for people who are what we call opioid dependent, whether it's from pain medications or other narcotics or heroin, for instance. So we have opioid replacement therapy that we utilize. And some of our clients are taking the Suboxone to help them avoid withdrawal and relapse onto illicit drugs or pain meds.
So when they have the two conditions, how do you treat that? And you have a very successful program that at the top of the program we mentioned that it does really work. So how do you treat them? How does the program work?
Yes, it is very effective. We have good success rates, good results, and you know, our clients tell us that this program has been a lifesaver for them. And I guess one of the elements of our MICD programming is that we work to help people learn to cope with, treat, and even sometimes resolve both mental health issues and chemical dependency issues or addiction issues. So we're working on both of them at the same time, rather than sending them to a mental health clinic just to get help for the depression and then go to an outpatient substance use treatment center to deal with addiction. We work on both of them in an integrated fashion. So, you know, when people come in with a mental illness, quite often they're confused, they feel alone and misunderstood. They're in a lot of emotional pain, And they feel overwhelmed, not knowing how to deal with, say, the symptoms of depression or anxiety. And it can be really not only hindering, but isolating. And sometimes in the past, drug and alcohol counselors or other practitioners would say, all you have to do is get off the drugs and alcohol, and then your life problems will resolve and you'll start to get more comfortable and be able to deal with things. But for people with a mental health disorder, boy, you can stay clean and sober and still continue to struggle with the mental health symptoms. So there are many things that we do to help people become not only more aware and understand better their mental health condition, but also to make them feel more comfortable in the group and learn ways of coping with some of those mental health symptoms.
So do they come for, is it outpatient? Do they come for a certain amount of weeks, days? How long does a typical type of a program work for the individual?
Well, our program is a 30-session, 90-hour program. It's an outpatient program that meets 4 days a week, Mondays, Tuesdays, Wednesdays, and Fridays from 9 to noon. And for the first month, our clients will come 4 days a week. And then after they've been coming for a month, they step down. We step them down to coming about 2 days a week for a month. And then for the final 2 to 3 weeks, they'll come 1 day a week. So we kind of taper them off the treatment in order to encourage them and help them to get involved with, recovery activities outside of our program. We found that works better than just having them come 4 days a week for 2 months or so and then have nothing at the end, graduate and have nothing. We taper them down. And then we also have an aftercare program that we can direct people to. Most of our clients will be involved with that. And that's a once weekly meeting, group session that meets for 2 hours for 12 weeks. So in all, our program lasts for almost 6 months. And then we can refer them on to additional programming or service coordination or other groups if they're looking for continued support and skill building. Yeah.
It seemed like that continuing part of the program would be really effective. Is there, once they've gone through this program, how likely are they to the mental illness to come back, or I don't know if it ever goes totally away, or for the chemical dependency to also come back?
Right. Both mental illness and chemical dependency we consider to be chronic diseases, and that doesn't mean they're always that people will relapse or continue to struggle with them, but people really need to continue to maintain their health and be aware of their conditions and treat them effectively over the long term. So we do find that if people can stay in some kind of a treatment program for 90 days or more, that their long-term outcomes are much better. And one of the problems with both co-occurring disorder treatment and chemical dependency treatment in the past is quite often people would go somewhere for a month or 20 days and then leave and have no ongoing support. And the chronic nature of these diseases would lead to relapse or an upsurge in mental health symptoms. So we really try to continue working with people, get them into additional supports and services so that they're able to continue to monitor and have some support and encouragement in managing both diseases. But in answer to your question, I would say that as long as a person is really maintaining awareness of their condition and continuing, if medications are recommended, to take medications and living a healthy lifestyle, they could have a very smooth recovery ongoing for a lifetime from both the mental health issues and the substance use issues.
What role do the medications play in mental illness and chemical dependency?
Well, it really depends. Some people with significant mental illness really require medications to manage the symptoms and really in some ways bring their brain functioning back to what we would call a normal level. A theory behind mental illness is that it's a brain disease, and that the brain chemistry of people, say with depression or anxiety disorders or thought disorders, is a little bit different than people without. So the medications really help to kind of correct that brain chemistry and allow people to function effectively. In that case, we do recommend that people stay on medications, sometimes for a lifetime, but consistently. And the medications could help them to really just live a very comfortable, aware lifestyle. For other people, they may start out on medications, and the meds might really help them to feel more comfortable. And Amy talked about having depression and ways that it really led to a lot of weight loss and low feelings of low self-worth.
Weight gain initially.
Weight gain, yep. And it really made it difficult for her to get out and about and be around people. Sometimes when people are experience acute mental health issues, the medications can help to get them out and functioning better. Over time, they might find that they don't need to continue the meds, but it's really, the medications can play a really important role, at least initially, in helping people to kind of get on the right track.
So the main message would be that you're not alone if you suffer from some of these disorders, mental illness disorders, as well as chemical dependency, and that there is effective treatment, successful treatment that really works.
Definitely, yes. There is very successful treatment. You're definitely not alone. It's estimated that about 10% of the population struggles with chemical dependency issues, and perhaps 20–30% of the population could struggle at some time or another with mental health disorders. And that's one of the really nice things about treatment is sometimes mental illness is referred to as an invisible disease. It's something that people don't talk about. There's no visual disability necessarily, and people tend to really carry around their concerns and their weight without talking about it or getting acknowledgement or help. And so when people come into our program, it's really, one of the really beneficial factors is they join a group of people who really do understand what they're going through and who are really making good progress in attaining goals and maybe rejoining life. And they get a great feeling of not only acceptance, but belonging also, and support. So that's a really key ingredient in the programming. I'd say another thing that we do in our programming is we really help people to build what we call coping skills. So we know that with many types of mental illness, one of the key difficulties that people experience is with their thinking. And so they quite often kind of misperceive things or have a very negative outlook on themselves, or hopelessness, helplessness. And so we try to get people to look a little bit, to examine and become more aware of some of the negative, we call them cognitions, that they're embracing, or their core beliefs that really hinder them from feeling confident, competent, comfortable. And then by using this cognitive behavioral therapy, they call it, we get people to become aware of those negative thoughts, step back from them, and then either alone or with the help of others, check out different ways of examining their thinking and maybe restructure or reframe their thinking to take a more positive outlook.
Yeah, I've heard a lot about different research, new research that really supports that's very effective in changing those thoughts and perceptions, and really can make it much different. So where can our viewers get more information if they or a loved one is suffering from mental illness and chemical dependency?
Gosh, there are a lot of resources out there for viewers. One organization I really recommend is the National Alliance on Mental Illness, or NAMI, and they provide a lot of really good services for people with mental illness or family members, loved ones of people with mental illness. And they've got a website at nami.org that will provide you with a lot of links to support services, education classes, family resources, more information about mental health conditions, and so forth. Another organization that is really good is Mental Health Association on Mental Illness, and they will provide people with screens to discover whether or not you might have a mental health condition, counseling resources, online counseling, information about support groups that you can attend, and different kinds of treatments. Also information about medications and so forth.
And then what if they're interested in your program?
Yeah, if they're interested in our MICD program, they could just call us at HealthEast, St. Joseph's Hospital, at 651-326-3645. And we can give you more information about our program and about other alternatives to treatment. I would say one of the really great things about our program is we do work within a continuum of care. So if somebody is stable enough and ready to enter into an outpatient dual diagnosis treatment program, they could come right to us. But if they're not, if they need a little bit more support or a safe place to, get stabilized, we could refer them to our inpatient unit. We also have psychiatric care, and we have what we call service coordination that people can go to for ongoing case management services, either after they've completed our program or possibly in lieu of our program. And the one other aspect of our MICD program that really is helpful is we also work with psychiatrists, addiction medicine specialists, therapists, and psychologists within the mental health clinic at St. Joseph's Hospital. So people can come for our outpatient programming, but we also like to get them hooked up with a psychiatrist who could manage medications, maybe a therapist for individual therapy. Many of our therapists do specialty groups, things like DBT groups, anger management groups, PTSD,
So very
skill building groups.
complex and comprehensive.
Yeah, we find that if you give clients, a broader assortment of services, they tend to do quite well.
And insurance, for the most part, covers this?
Yes, we do accept most insurances. We also work with Department of Human Services. So for instance, Ramsey County residents, we accept MA, MNsure, consolidated funding. We have some scholarship programs. We have many clients who are unemployed or disabled. We also have many clients who are working with private insurance. We take a broad range of insurances.
And I think that you also had a hotline number that people, if they're in crisis, that they can possibly call to.
Yes, I do recommend the Crisis Connection. It's a nonprofit organization that provides 24-hour crisis counseling. Anyone can call that at any time, toll free, and the number should be up on the screen. And they're a very good organization and can not only maybe talk you through a difficult time, but also refer you to some good resources that be helpful.
Final comments for our viewers?
Yes, final comments. Well, I would hope that if somebody out there is feeling depressed or struggling with a mental illness, and they also are having trouble with drinking or with drugs, that they would reach out and call us for some help, because I've seen so many lives turn around. And what is typical is people often come into our programming feeling pretty hopeless and demoralized, and even feeling like, what good will this do? Nothing's worked, and so lonely and isolated. And within a few weeks, I really notice a shift, and people start to get engaged and they find hope, they find strength, and what at first seemed overwhelming and impossible becomes a reality. And so no matter how you're feeling today, or I encourage you to reach out to us for help, and I'm sure we can steer you in the right direction.
Well, great information for our viewers. Thank you so much, George, for being with us.
Oh, my pleasure.
We really appreciate it.
Yeah.
So thank you so much, and we'd like to thank you for joining us. We hope you'll join us next time on Inside Healthcare. We'll see you then, everyone.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.